2, 1. Medic 2, you are needed for a 34-year-old patient who has fallen from a grain bin. Patient is conscious and breathing.
All right. So we arrive on scene. I'd put on my PPE.
Okay.
I would
What would you use for PPE?
wear gloves and I would be
Okay.
Yep. Then is the scene safe?
Yes, the scene is safe.
Okay. What's the scene like?
So you arrive to a farm that is currently 4 miles north of a rural community. Upon arrival, you find your 34-year-old patient lying on a cement pad next to a 20-foot tall grain bin. The brother of the patient tells you that the patient fell from the top of the bin ladder, landing on his back. You know that you are currently 10 miles away from an ER and you are 1 hour away from a trauma center.
Okay. I'd make note of the mechanism of injury, so we know that he fell. We knew that he fell from a distance.
Okay.
I would also make note that there's only one patient on scene. That's a correct statement.
That's correct.
Okay. I would get life flight on call. I'd have them en route, and I'd have ALS coming
Sure.
due to the distance. I would do spinal stabilization as well as a C-spine to make sure that he don't move and damage more spinal stuff. So if I ask the patient what hurts, what does he tell me?
The patient tells you that both his lower back hurt as well. He has shoulder pain.
Okay. All right. And then his responsiveness and alertness is okay.
He does appear to be alert.
Okay. And is he talking to me?
He does appear to be talking relatively well.
All right. Then, so I would assess his airway.
Okay.
Is there anything in his airway at all that we're worried about as far as?
He does appear to have a patent airway.
Okay. Is his breathing adequate as far as chest rise and fall goes? And
He does have equal chest rise.
okay. So I would check his radial pulse.
Okay. His radial pulse is rapid and strong.
All right. And then if I was to try to get a pulse reading, what do I get?
If you check his pulse, it reads 122.
122. Okay. 22. I would go for his blood pressure.
Okay. His blood pressure is going to be 130/86.
Okay. 130/86. Then respirations.
His respirations clock in at 28 breaths per minute.
And then how about his SpO2 and?
His SpO2 currently is 95%.
Okay. And then pupils.
His pupils are pearl.
All right. So get that down. No, we have a immediate transport going. Is there any signs of shock?
What would you be checking to determine that?
So, how's his skin feel? I guess what's the answer?
Checking his skin, you find that it is pale, warm, and moist.
Okay. So he's in shock. I'd get him supported in a supine position. I'd give him high flow oxygen.
Okay.
And yeah, I think there. Okay, so we got his baseline vitals. Sample history, signs and symptoms. To here.
He appears to have fallen.
Okay. Any allergies?
He says he does not have any allergies.
Any medications?
He does not. He's not on any, sorry.
Okay. Any previous medical in the last 6 months or so?
He says nothing major. He said he had a kidney stone about 6 months ago.
Okay. What's the last time he ate?
He said around lunchtime he had a hamburger.
Okay. And then any events that he can recall prior to him falling?
He tells you that you remember climbing up to the top of the grain bin, and you remember slipping and falling from the ladder.
Okay. So I would go into my secondary assessment. I would palpate his head, checking the scalp and ears, his nose, mouth.
Okay. You find that his facial bone is intact. There is no fluid coming from his ears, eyes, or nose, and he has no obstruction in the airway.
Okay. If I was to palpate his neck,
Yes, light JVD.
JVD. Okay.
Is there anything else you're looking for when you palpate his neck?
I would check the spinal column there to see if there's any deformities
He
inside.
doesn't appear to have any cervical deformities.
Okay. Then I'd move on to the chest. So I'd palpate his shoulders and chest area.
You don't notice any crepitus or flail segments, nor does he appear to have any open wounds.
Okay.
As you palpate, it does appear to be very tender over his right ribs. You do note some bruising.
Okay. And if I was to check his lung sounds,
His lung sounds, they are clear bilateral, but they are diminished in the bases.
okay. Moving down, I would check his abdomen and pelvis area, palpating that.
They appear to be soft. You note no distension or injuries.
Okay.
No major injuries noted.
All right. Pelvis. So I'd go down to his lower extremities, checking his right and left leg, his feet.
So checking his lower extremities, you notice that his right leg is both swollen and deformed.
Okay.
Though no open wounds are noticed. You don't see any open wounds.
Okay. Going up to the upper extremities, both arms, hands.
What'd you say?
Checking his hands and his arms. Anything there?
Checking his hands and his arms, you don't notice anything.
Okay. I would try to maintain that right leg, which is deformed, so I try to stabilize it.
Okay.
Make sure that
How would you want to do that?
I put a splint on it,
Okay.
so I'd splint that. I would get him loaded and go. While we're en route, I would do a secondary reassessment, I guess.
Okay.
Getting another set of vitals. So, if I start off with his blood pressure, is there any change?
His blood pressure has gone down to 124/80.
Okay. His pulse, any
His
changes?
pulse clocks in at 130.
Okay. And respirations,
30 breaths per minute.
and then pupils,
I'm sorry.
eyes, pupils.
Oh, his pupils are still pearl.
Okay. And then SpO2.
You note that his SpO2 has increased to 96% on the oxygen.
Okay. So, I think we're good. Oh, I would reassess the patient every 10 minutes.
Like to do what now?
I'd reassess the patient every 10 minutes to see if changes.
Okay, sure.
And I think we're good. That's all I got.
Is there anything else you want to do with this patient?
I don't think so. I think I'm good.